Shayna.
Hello.
How
Thanks
are
for
you?
having me. I'm good. I'm good. It's good to see you. Thanks for
You
having me.
too. Absolutely. Thanks for coming on the Great Grind of Autism. I'm so excited that you agreed to join us today because you will always hold a special place in my heart. Um, I've known you for a long time. I want to say possibly like 13, 14 years. It's been a long time because you first started working with Aiden and then with Colin and then with
Hmm.
both. Um, And so you were kind of our first OT, but you worked with them for so long and did such magical work together. Um, I'll always just be so grateful. And we did a lot of special things, I think, along our journey together. And I think we worked together for maybe 8 years. Does that sound about right? 9 years?
That could be. Yeah.
Okay.
Yeah. And honestly, it is definitely a mutual feeling. My own kids know the names Colin and Aiden because
Oh,
they made an impact in my life that when I refer to, different situations or things and I mention them, they know exactly who I'm talking about.
I love that. That's so sweet. That's so
Yeah.
sweet. Well, I just want to take a quick moment. Usually, this podcast is geared more towards Colin's community and peers and their families. Um, but I just wanted to pause and just recognize how amazing Aiden is doing. Um, he just was accepted to McDaniel College and he's going in the fall and he's doing a dual major of psychology and sociology. And he's just been inspired by his own life journey as well as his little brothers and a lot of their friends. And he just wants to better understand the brain and make a difference in the future. So I couldn't be more proud of this young man. He's just amazing.
That's incredible. That is such
Yeah.
a great story. I mean, he's come a really long way and he's has great role models that he's been following with you guys. So it doesn't surprise me.
Well, thank you. And he's as funny and witty as ever. um, so, he is just, there's no doubt he's going to do amazing things in life. And he's had so many wonderful people supporting him along the way and inspiring him along the way. And he's also very open and proud of who he is and what makes him who he is. So I am just so proud of him. And, um, and Colin's going to also do amazing things in life. It's just going to present a little bit different, but he's guiding that and he's teaching me and so many others his current support system at school and, you know, the families and friends that we have there. Um, he's teaching us all just like they all are.
Mhm.
Um, there's a lot there's a lot they have to offer our world, and we just have to keep supporting them, but being open to learning from them.
Oh,
So,
absolutely.
so I am super excited to talk to you today. Not only my personal love for you, but I just have so much admiration and respect for your own journey because I remember when you were still going to school um, for your PhD. So, if you could just take a moment and introduce yourself and, just basically let the listeners know whatever it is that you would like them to know about you, and then we'll take it from there.
Okay, sure. So, as you said, I'm Shayna. I've been a pediatric occupational therapist my entire career of occupational therapy. So, starting really young, I always knew it was going to be something where I was working with kids. It's always been something that I've really loved doing. And then when I was in elementary school, my parents are both teachers. My mom is a special ed teacher, and had an injury that occurred while she was at work when she was working with one of her children and ended up with permanent nerve damage in her arm. And when that happened, she ended up being in a whole world of pain and needed to go through a lot of physical therapy and rehab to try and gain back function of her arm. And she lost sensation, she lost muscle strength, she couldn't do everyday things that she would typically be able to do, like cutting her own food or buttoning her shirts or being able to maintain a grasp on her keys, just these everyday things that you take for granted. And she would go to physical therapy and she was getting stronger and making all of the milestones and everything. But then she went to an occupational therapist, and that was the one who was able to help give her back the functional reason that she was gaining the strength. So they showed her some adaptive equipment where then she was able to use a special knife, and all of a sudden she gained independence because she could cut her own food again. Or she was able to, use special braces and grips to be able to hold a lacrosse stick and play catch and play lacrosse with me anymore, again. And so that was something where you could see that it wasn't just that she was gaining back this function, she was gaining back the meaning and the purpose for herself, for her life, of what she enjoyed doing. And when I learned that you could do that and be in work with kids, I was sold. And so from, going into college, I knew that's exactly what I wanted to do. And it's always been my journey, and my path is working with children to help promote their independence. When I started with it, I started learning more and more about sensory processing. And that's what I did a lot of my focus on when I did my doctoral work, that kind of knew me more along that journey, and really got excited about it and really see the benefit and how that's such a big part of a lot of these children that we work with. And a lot of times, some of the things that are seen as behaviors or tantrums or things in a negative way is really just them having difficulty interpreting sensory input going on around them or processing it differently. And that there are things that we would be able to do to make a change with that. And I got so excited, wanted to learn so much about it. And that's kind of where I've been headed, and did a lot of understanding it. So, I did it with a lot of my treatment and practice that I've been doing. I've now kind of shifted my focus, and I've been specializing in doing evaluations of children and writing initial IEPs and advocating for school-based support. And with that comes a lot of parent education, because now we're getting a lot of, children where we're oftentimes the very first people who are identifying some of these needs that they're having. And so there's a lot of parent education that we do where I'm explaining the sensory side of things and giving just real world strategies of things that they can do at home. Because gosh, I mean, you know how things go. We have these evaluations and then we say, we'll see you in a month for the meeting, right? Where then we write the IEPs, and these families are always, so hungry for strategies. What is it that we can do right now? And so I love being able to just jump right in and give some real world things that you can do in the moment to be able to try them out, see what works, see what doesn't work, and kind of better understand the reason behind some of the behaviors or some of the things and challenges that we see, and figure out ways to make things a little bit easier.
That's fantastic. And just a couple points while you were talking. The first thing, I just want to jump back to your mom story for a quick second.
Yeah.
And I'm so glad that you described that, because I think often we think of, when we use like adaptive tools to learn, we think of our kids are delayed, so they need this assistance to learn, and that developmentally they've caught up and learned that skill. But what you just described with your mom's story is that it's truly part of the habilitative process. And it shows that, yes, it could be part developmental, it could be part the sensory input that you're providing, but it shows crystal clear that it isn't a tool to get you from A to B. Do you understand what I'm saying?
Exactly.
Yeah.
Exactly. And honestly, I think that looking at, adaptive equipment and things just like that as tools,
Mm-hmm.
is really important. It is not what is making it happen. It's
Yeah.
helping give you the access to make it happen.
It's such a valid point for parents just to pause and think about that for a moment. It's just a tool, and it's helping learn a skill and create independence slowly but surely, one skill at a time. So
Exactly.
that is such a great story about your mom, and it's all because of her. I'm so sorry for her injury, but my God, her injury and recovery inspired you, and you have helped so many families across the state that I can't even. I
Oh,
mean,
thank you.
so would you please thank her for me? Because I mean, seriously, this is just such a beautiful story. I love it.
Thank you.
Um,
Thank you.
and then jumping forward then to the sensory piece, I'm just so glad that we're having this discussion because I remember probably, 10, 12 years ago, it was really difficult to get like a sensory processing disorder diagnosis. And I don't know if it's any easier. Um, but what, and maybe you can give us some input if you know, but what I do want to hit on is the fact that because you and other OTs are providing that sensory integration, how much more it's helping our children.
Yeah.
Because I
So,
don't know that, sorry, I just wanted to say, I don't know that like all families necessarily identify or understand the sensory piece.
yeah, it's hard because, there's been a lot of push to try and get a diagnosis of sensory processing disorder in the DSM manual, right? That's kind of the code book that's used by pediatricians and psychologists to be able to identify and diagnose specific disabilities. And it's not in there. It hasn't made its way yet. So is it an official diagnosis according to the DSM? It's not, but it's still recognized as a challenge that people have, but not as a standalone diagnosis. Oftentimes it's associated as, something that often children with autism might have, or children with ADHD or ADD might have. And it's something where it is recognized by insurance companies and things, but it's coded not really as a sensory processing disorder. Oftentimes it's more coded as like an unspecified neurological disorder. So it is, something that is recognized by the medical community, not generally as a standalone diagnosis. So,
Mm-hmm.
and honestly, when I think of it, I don't really like looking at it in terms of a disorder. I like
Mm-hmm.
to think of it more in terms of a difference because, when you think of sensory processing, and really delays in general, right? We always do these standardized tests where we mark a delay by how far from the average you are, right? If it's one standard deviation away, it's considered, below average. If it's more than that, it's more significantly delayed, right? But sensory processing isn't supposed to be viewed that way. When you do these standardized assessments to view it, it's not that if you are processing the sensory information significantly different than other children the same age, that you are seen as having a more significant disorder. It's just more of a significant difference is how it's viewed. So it's not really supposed to be viewed in terms of standard deviations. So I never really liked that term when you're talking about sensory processing of it being a disorder, but it is a difference. And, typically children, adults, everybody responds in a way that the world is accommodated for, right? And so
Mm-hmm.
the challenge comes into play when there's a child, in this context who processes things a little bit differently, and the world isn't adapting to that, then it's seen as having these challenges that are arising, right? But it's just that they're processing it a little bit differently.
Yeah, that's beautifully explained. I really love the way you explained that. So could you talk a little bit about sort of how you started as an OT and how it sort of morphed into the sensory piece and kind of what that looked like as a treatment?
Yeah, so sensory integration
Mm-hmm.
is actually something it's considered a theory, and it's also considered a treatment approach. So the idea of sensory integration is that everybody, you're learning, you're responding to things going on around you all the time. And the theory of it is that you can use it to understand behaviors and things that are going on and create different approaches to help alter some of those behaviors, right? And so that's what that sensory integration therapy that's often done. The reason it really resonated with me was in school. I remember in high school, we talked a lot about Maslow's hierarchy of needs, which is like that psychological um, thought process that in order to become your best self, which they consider self actualization, you have to go through these basic steps of needs. And so the first level of that is your physiological needs. So you really have to just, basic needs have to be met of food, water, shelter, sleep. Once you have that, then you can move up to, another level of needs, which is I'm pretty sure the next one is safety, and then love and belonging and your self-esteem. And there's all these different levels that have to be attained before and met before you can become your best self, which is self-actualization. I'm doing these shapes with my hands as we're talking because the image of it is this pyramid. So the very top of it is the self-actualization piece. And when I was learning about sensory integration, they related it to that. And they were saying that the sensory integration and your ability to be regulated is at that bottom level of your physiological needs. If you are not regulated, right? And when you think about it, like if you are not able to really process and interpret and understand what's going on around you or how your body is feeling in this environment, you're not able to meet any of these other levels to be your best self ultimately, because you haven't met that very basic function that's right down there with food, right?
Yeah.
And so that to me was like, well, this is incredibly important then. We have to be able to make sure that this is addressed. And so oftentimes that's where I start with a lot of my therapy that I would do. I remember really connecting with this actually when I was working with Colin. And I remember when I first started working with him, there's all of these different terms when you talk about, sensory processing. And at the time, his registration, so the way that he was recognizing sensory input, was very low. So he wasn't responding as much to things that were going on around him. And so I remember thinking, okay, so let's try and give him additional stimulation and see what happens. And I would try, different swings and all kind. We would, because one of the big things with sensory integration, for those that aren't familiar with it, is a lot of it is kind of imposing these controlled sensory experiences in different ways to be able to kind of change the neural pathways and the way it is that your brain interprets that information. And so one of the strongest ways and the kind of the core of sensory processing is through your vestibular system, which is the position of your head in space and being able to recognize kind of where you are. Am I upside down when I tilt my head to the side? Kind of just where you are in space. And we always talk about, your five senses, right? That's the basic thing that you learn in school, but there's actually really 8 of them. And the ones that we don't talk about are kind of really important. Like there's the vestibular system that we just mentioned. There's the proprioceptive system, which is that's what lets you know the limits of your body. And you get information about that when your muscles and your joints are compressed and contracted, kind of pushed apart and like squeezed together. And then there's also your interoception, which is your ability to recognize what's going on within your body. How are you feeling? This is kind of what's responsible for you being able to recognize signals that your organs give you. Like, I need to go to the bathroom because my body's telling me that. So these are all really important. There's actually these 8 sensory systems, and the vestibular system is the one that's kind of the hub, right? And so with that, when you change the position of your head in space, you're activating it. And so with Colin, I remember he was not really responsive at the time to really what was going on around him. And I was trying different things. And there was one day when I put him in a net swing and started swinging him back and forth. And he wasn't really looking. He was laying on the side. This is such a core memory for me. And, I was doing bigger swings back and forth. And then all of a sudden I just stopped it suddenly. And he looked at me, smiled, and started laughing. And I immediately started crying. And I remember his teacher was teaching in a room next to my therapy room, and she opened the door and she recognized that that it was him. She was like, "Is that my baby?" She started crying just because we had this connection that we got to him in that moment.
Yeah.
And so from then on, I was like, okay, like this is how we are going to connect with Colin. And swings for him was a big part of our therapy that we would do to really start and get him activated, right? We were increasing that sensory input and giving him additional stimulation that he really needed to connect with us. And so that was something that for me was so powerful to understand the influence that the sensory processing piece really can have on somebody.
Yeah, Colin does that to a lot of people, because everybody sees Colin as the beautiful human that he is, and they also see the stuckness in many ways, but also all the potential in between. And when they have breakthroughs with Colin, it's huge, and he keeps having really huge breakthroughs. It's been very different presentation. Like with Aiden, things just like it was like the light bulb went off or something. All the neurons or pathways activated when he was 4.5, and then it just never stopped. He just was able to catch up and move forward with his peers. And with Kyle, there was more stuckness, there was more delayed for longer. And this conversation, because it was a long time ago, is making me realize I think this is literally where he was stuck. And how can you learn? How can you have learning readiness when the phrase I keep remembering in my brain that was said to me was he's unaware of his place in space. And it makes sense because when you first wake up in the morning, this is kind of the little parent analogy I use to talk to parents, because it's the little, I'm scraping the surface since I'm not a professional. But I always say it's like when you first wake up in the morning and you're so tired, you need that coffee to get regulated, or you need that hot shower to get regulated. But like our kids in many cases need lots of support and a lot more input than a warm shower and a cup of coffee to get them regulated to get from A to B, whatever A to B might look like.
Yeah, absolutely. And it's actually one of the things that makes sensory processing and understanding it so confusing. And I think that's why everybody kind of has this muddled sense of it, right? Because there's all of these different subtypes of it, right? Like they actually say there's 13 different subtypes of sensory processing challenges that somebody might have. And you could have just one, you could have several different ones. And if that couldn't be confusing enough, sensory processing changes. So as soon as you feel like you have a sense of what strategies work, all of a sudden, sometimes they might not. And you might have to figure out additional strategies and things that could be beneficial. But, with sensory processing, you talk about sensory modulation, right? And this is, being able to recognize whether a child is over responsive, meaning that their sensory system is extra reactive to what's going on, right? This is what I remember Aiden to be actually when he was really young. He was extremely sensitive. I remember to the moon bounce that they had that was part of the kind of just a common play area that they had, to the point that he had challenges even walking by that room because the sound of it was going on. When you think of it actually inflating in general, it gets really big and it's large and it's just very overwhelming.
Yeah.
Then there's also children who are under responsive, right? This is more like what we were describing, what I remember Colin to be when I first started working with him. And these are, often viewed as children who have kind of lack of engagement with other children, lack of engagement with the world around them, can cause some poor body awareness. These are often kids that might trip and fall, might bump into something and not really even be aware of it. not
Yeah.
because they don't care what's going on around them. They just aren't recognizing, what it is that's there. And then there's also sensory cravers. And these are some of the kids who are just constantly on the move and touching things. And what's more challenging is with a lot of, under responsivity or over responsivity, there are things that we can do to try and either alter the stimulation level, right? Like we can make things a little bit quieter for those that are over responsive. We can provide extra stimulation for those that are under responsive. Sensory cravers, you see them moving all around. And oftentimes you might try and provide additional sensory stimulation. And for them, it doesn't necessarily cause them to become more regulated. They're still continuing to seek that sensory input. So that's one part of the sensory processing piece is the sensory modulation. There's also some sensory-based motor disorders. So these are things like postural disorders that can arise from having sensory processing challenges, right? If you don't know where it is that you are in space, it can affect your physical posture and how it is that you're moving. You're going to look oftentimes clumsy or uncoordinated because you're just having difficulty navigating your body and where you are in space. Oftentimes children also might have adults too, but I'm focusing more on kids right now, but
Sure.
motor planning problems, right? Sometimes this is also termed as praxis. And this is just the ability to carry out, like plan and sequence the steps needed to carry out a new action, right? Or a new task. And so these in school, we're trying to get children to constantly learn new things. But if you have this motor planning challenge, that's exceptionally difficult because it's not just this is the first time that I'm hearing how to do it. And so that makes it hard. It's also, I can't really figure out how to move my body to make this happen. And so oftentimes this looks like a child repetitively doing it inefficiently over and over and over again, and not really being able to make those slight changes on their own to try a different way to become successful. And so that's where they might need some additional support. Oftentimes I see this with kids when we're first starting to introduce dressing skills with buttoning, where, I will use all kinds of, verbal cues of this is what you do, and we'll do it really large scale and we'll give, and ultimately, no matter what it is that I'm doing, they're constantly just pulling apart the buttons versus trying to actually get it through the hole and do kind of that lacing piece. And that's like a very concrete way to see this motor planning challenge that sometimes arises from the sensory processing. And then the whole, other 8 forms of it all just have to do with being able to discriminate between all of the different senses, right? So a child who has some sensory discrimination disorder, like they have difficulty discerning and really identifying the specific qualities of something that they're experiencing, can also affect them. So, if I have tactile discrimination challenges, like my sense of touch is impacted, that's going to potentially affect how it is that I am able to tolerate clothing, right? Because the light touch of the fabric might be really irritating to me. It could be that I'm not able to really tell if the water is hot, and then there's a safety concern that can be part of it. And so what we then try to do for children who have these challenges is pull in one of the other senses as a cue that gives them additional cues, right? Like everybody, hot water is always on the left, right? So might not be able to recognize by touch by the temperature, but you can tell, okay, but I need to turn this one on or the right one on to make it cold so that I'm safe, right? You pull in some of these other strategies to be able to help make it more successful. But just with the sensory processing in general, one of the big things that we find and that research has supported is that with new experiences, somebody who has typical sensory processing generally is able to attune to it and become like it's more predictable than somebody who has challenges with the sensory processing. So for example, they did this study where they would put somebody in a chair and then suddenly tip them backwards. And they found that those who had the challenges with the vestibular processing, every single time they got tipped back, it was alarming to them. Whereas after a while, somebody who processed the sensory information more typically, after a while, it wasn't as big of a deal. And their brain wasn't recognizing that this was a fear response, that all of a sudden they're being startled because they know it's coming. But imagine
Mhm.
having this challenge and living in a world where it's always so alarming to have these things happen, like especially with that tactile sensitivity. A lot of times we see, children who have difficulty tolerating tags in their clothing, or parents might get frustrated that they only want to wear a specific shirt and you have to do laundry so many times to make that shirt happen just so you can get out the door. And really, it's just that some of these very particular sensations are so heightened that it's all that really can be focused on to be able, and the idea of moving past that is very challenging.
Yeah. And I am like carrying out these scenarios in my brain and just seeing how things escalate into a full-blown meltdown because it's so much for these kids. And it's a lot. So I am so hopeful that this discussion is going to enlighten parents who might not understand this piece. It's really hard to navigate as a parent, and my biggest hope is just that they can find patience and understanding through love because this is so much for any one human to have to endure.
Yeah, I think the patience and the understanding and recognizing that some of the things that might be seen as, rightly so, are tantrums or meltdowns really is a form of communication
Yeah.
of, showing I am either uncomfortable with what's going on, or I'm anticipating something that's going to make me uncomfortable because of whether it be a past experience, or I need to know what to expect and this is unpredictable. And so I'm going to do whatever it is that I need to do to avoid being in that situation. And so oftentimes that can be seen, as being aggressive. It can be seen as having full behavioral meltdowns. But in those situations, right, like think back to how we're saying it's a feeling of constantly being startled. That's essentially a fight or flight response, right? You are
Yeah.
fighting to get out of a situation that you are feeling unsafe in.
Yeah. Going back to what you were saying about the sensory seekers, because I feel like at some point or another, Colin was all of these. And you said it's always changing. I mean, it might not be constantly changing, but like the techniques that you're using, depending where they are, is changing. But I do think as Colin has gotten older and has, continued to develop and broken through certain milestones or gotten maybe better with knowing his place in space, that other things got more heightened, right? So he's definitely, he doesn't seem as sensitive to like loudness any longer. We went through a phase where it was always headphones. That's sort of, we're done with that now. But he has for several years been, you know, the sensory seeker. It's just nonstop movement. And I told you he kind of does this little musical circuit. And, he's appropriately playing with musical instruments. But having said that, it can be nonstop. And I mean an hour, 2 hours. Aiden's trying to watch TV. He can't hear anything. I'm trying to have a conversation. It's hard. I've had to train I'm very conditioned and adapted to our way of life. Somebody would probably walk through our house, come in our house and be like, what is happening here? What is going on? Because it's so big and it's so many things going on. Um, I've conditioned myself because I'm mom and that's what we do, right? And we adapt to our kids' needs while supporting them. But basically what I'm trying to get at is, does that sensory seeking, is that the same as sort of being stuck in a motor loop, or is that different? Or am I sort of intertwining maybe two different theories?
You mean motor loop, like kind of just repetitively needing to do something?
Yeah.
Well, from the sensory perspective, it's that you're seeking to try and fulfill and get additional stimulation, right?
Mm-hmm,
So I
mm-hmm.
know, you know, specifically like Colin has had the chewy tube, really, that he uses very actively, right?
Yes, yes.
And, that's a way that I think he has found to get some additional sensory stimulation pretty regularly, as when he has it. And honestly, proprioceptive input, right? The one that kind of lets you know where the limits of your body are and you get through the compression of the joints and the contraction of the muscles and everything together. The strongest and most powerful way to get that kind of input is through the jaw. And so that often is why we have, people who gravitate towards the chewy tubes, or, oftentimes really young children might start putting non-food items in their mouth and kind of just chew on them like those really heavy plastic things. And then we kind of try and replace it with things that are a little bit safer and more appropriate. And, it's that you're trying to kind of get that input. So I don't know that I would think that it's a motor loop
Okay.
situation as much as trying to feel good, like fulfill the sensory seeking in some way, whether, it's the movement of cycling between the different things, whether it's the auditory input that you're getting from, hearing all of the instruments going. I mean, in general, music is a very stimulating thing. It's the only thing that activates both sides of the brain at the same time. So it's a
Yeah.
really powerful thing, for anybody to use, because it's very activating of the mind. I think when it does come to situations where it is affecting normal household life, that's when we start to pull into look at other strategies of how to accommodate it a little bit. Like it might be, trying to pull in headphones or something where he might be hearing the music, but everybody else might not be hearing it quite as loudly, or, being able to provide additional input through other, um, heavy work, like the proprioception piece. I went to a training one time and they had this tag phrase that they said, when in question proprioception, because in general, anytime that you're doing that compression, it is very regulating, calming to the central nervous system, to the brain, to the spinal cord. It's very calming to the whole body. So if it's something where it just seems like it's getting over over the top, like just out of control with it, trying to find activities and things that implement more of that deep pressure might be a way to kind of bring it down a little bit.
Okay. I have noticed as Colin gets older, he has found ways to advocate for himself and request input. So he's not just relying on therapists and teachers and parents observing him, but literally he's putting his hand out and he wants you to smack it in between his hands. Or
Uh-huh.
get or putting the elbow up and he wants you to squeeze that, like things like that. And the last question I have on this point is that are you able in your practice, are you able to identify when it is a sensory seeking person versus crossing over into anxiety? Or is it a very fine line of teasing out?
Yeah. So with occupational therapy, we wouldn't really tease out the anxiety piece. That would probably be more like psychology, that they would have specific assessments and tools that they would do for that with reading scales. But the way that the sensory processing part is really quantified, or really, assessed, is through really two main tools, and they're questionnaire based. One of them is the sensory processing measure, which is a standardized assessment. One is the sensory profile. That one's been around a lot longer. They both have second versions of them now. And they are questionnaires that can be completed by caregivers, whether it be teachers, whether it be parents, really anybody who knows the child, or the adult is able to complete these questionnaires, and then they're scored. And then you can see certain patterns of where those sensory systems are either, more responsive, maybe they're under responsive, you might be a sensory seeker, You could see whether or not it's specifically in the oral sense. You can see whether or not it's in, the tactile sense, and you can kind of tease out some of those things specifically.
Mm-hmm.
That being said, if we're not doing it like a standardized assessment, I do personally often see children be identified as somebody who has specifically sensitive hearing, because parents will say that they cover their ears a lot. And I, in my own practice, feel that that's not always the case, because oftentimes I see that more in line with anxiety of new situations, right? Because it's not, when you look at the context of when it's happening, it's not necessarily in response to a loud sound. It might be like they're going into a new room that they haven't been in before, and then they're covering their ears. So I do think that there is an anxiety component
Yeah.
that sometimes can be mislabeled as a sensory thing. I think that there are sensory strategies that can help calm some of the anxiety, but I don't think that, I think that they're more like some mutually exclusive
Yeah.
diagnoses that would happen.
It's just one example of what makes like our kids very complicated, both within their autism diagnosis as well as any medical complexities on top of it, and then psychological complexities and things like that.
Yeah.
Um,
But I mean, from a sensory side of things, if you think about, a child or an adult like being in a situation where they know if it's if it's unpredictable and I don't know what to expect, it makes me feel uncomfortable,
mhm.
because I might be in a situation that things might be too loud, things might be, and so I'm going to try and avoid that. That in itself, where you're having these feelings, that is anxiety, right? So there is some connection there. But in terms of the diagnosing of that piece, that part wouldn't generally be done by an occupational therapist.
Yeah. Yeah. You can, but like you said, you can obviously try treatment um, protocols or strategies to help to bring it down a little bit.
Yeah, absolutely. And a lot of that is really trying to observe and recognize patterns of behaviors to see if you can really try and pinpoint when you see those kinds of things happening. And so that's where a lot of these questionnaires are actually really good, because they give so many scenarios of, well, how would this person respond in this context? How would they respond in this context? And then it helps identify those patterns. So if it's something that, is a question whether or not the sensory piece is causing some of these challenges, it definitely would be worth, having an evaluation done to be able to tease some of that out.
So, for our listeners whose kids are in the public school system, they can request that through the IEP team, or how does that work? Or do they have to do a third party private pay?
No, so if it's something that, is affecting the child's ability to access the curriculum, right? That's
Mhm.
the term that they always use. It has to be able to be impacting their ability to access the general education curriculum.
Mhm.
Then you can request to have an evaluation. And the sensory processing piece is something that could be part of that evaluation.
Okay, perfect. So, one last thought on this, and then we'll move on to some other alternative therapy. Since the boys started early intervention, what was referred to as a sensory diet was introduced to us at like 2 or 3 years old. And they always had one, and it was very, very helpful. And I think a lot of parents or families out there, caregivers, would be familiar, but maybe you could just touch on that in case they are not familiar and it's something that they could ask their IEP team about.
Yeah. So sensory diet is kind of like the coined term to describe this, but it's a formal plan that is developed. I like to think of it more as a sensory buffet because, like I said, it changes, right? And diet seems to feel like, to me, these are very specific activities or specific accommodations that need to be made. But I think if you're understanding the reason you're making those changes, then you can come up with more ideas of ways to do it. And so that's where I think like kind of that buffet piece comes in. So, for example, the idea behind the sensory diet is for these children who are sensory seekers or sensory avoiders, or that they are reacting some way to either get more sensory stimulation or they're trying to avoid sensory stimulation, that you are, we'll talk, I guess, in terms of the sensory seekers, right? There's a child who maybe has a really difficult time sitting still and they're constantly on the move and they can't really focus on one thing because they're focusing on everything going on, right? So it's
Mhm.
really difficult to be able to get them to hone in on a specific directed activity that we might be trying to get them to learn. This isn't a case that the child isn't trying to pay attention. They're just having difficulty honing in on the one thing, right? And
Mhm.
so what we would then do is try and instead of reacting to it and saying, "Oh, no, 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 come and sit down. You come in, we're going to make you sit." We're going to proactively recognize and meet that sensory need ahead of time. So before you're expected to sit for a while, let's give you some structured opportunity to be able to meet that sensory need. So if it's that you're kind of wandering around, maybe it's that you need some additional vestibular, some movement input. So we're going to find a way for you to be able to do that so that then you are better able to sit down and focus on this activity because we've already met that need that you were seeking. Now, the tricky part is it's not something that you can just do once and then be set for the day. You have to really be able to build these activities throughout the day. So just like your diet isn't going to work if you just do it for breakfast, right? You got to
Right.
maintain it throughout in order to see progress. It's the same thing. So these are, activities and things that you do proactively to meet the sensory needs of the child, that you do in school, that you also educate the family so that they do at home, that you do before they go to whatever extracurricular thing that they do, because you need to maintain their state of regulation, right? It does not have to be a specific activity that you need this tool to be able to use all the time in order to make the activity successful. So, there's all kinds of equipment that's out there, right? So they have wiggle seats and things to help provide vestibular input for children who have difficulty sitting still at a desk. Those are great. But if I were to say, in order to provide that input, you have to always have this wiggle seat with you, that's not functional. We're not setting you up for success. But if you understand that it's because my child needs this active movement, well, then you could try and come up with ways to do that just naturally in the context of the day. Maybe it's that, when you wake up in the morning, that you do some sort of movement song that you incorporate as part of the getting dressed in the morning routine, that you if you have a swing set outside, that you're doing some active playing outside first before you're going in the car, that you're just kind of building it in because you're understanding where that need is coming from and you're meeting the need, not just meeting that one action.
Yes.
Makes
Yes.
sense.
It does. It does. And I remember, so just for the listeners out there, so like for my younger son Colin, obviously his um sensory diet plan looked very different um than what Aiden, my older sons, look like. And even like through high school on Aiden's 504, because he no longer needed the intervention piece, so he went to a 504. But we had those breaks built in. So it would, I don't know, the teacher would say, "Hey, Aiden, would you go to the guidance counselor and pick these things up for me?" Very simple strategy, right? But it gets him out
Exactly.
of that seat because in high school, these classes are 90-minute chunks. That's hard for a kid with autism, with ADHD, with any kind of sensory, piece going on. I think it would be hard for me to sit for 90 minutes. Like I would have to make an excuse and say, I need to go to the restroom, get a drink. It's a long time.
Right. And we do that. Like those are things that naturally everybody does. There are people, if you have an office meeting, there's somebody who's chewing gum, there's somebody who's bouncing their foot, there's people who get up and they walk around, right? But it's not labeled that you're regulating yourself or that you're meeting a sensory need, but that is what we're doing. We just have already
You're
learned
right.
strategies to do it naturally. There's
You're
people
right.
who cannot function unless they go to the gym in the morning, right? From a
Yes.
sensory perspective, they're getting vestibular input, they're getting proprioceptive input, they're setting their body up to be able to be more calm and regulated throughout the day. So they figured out strategies that work really well for them. So I love what you were saying, that Aiden's teachers did it in a way that's functional of, you know, you need to get up and move. Let's do it in the context of going for a purposeful activity, of going to go and get something from the front office. Sometimes it could also be, you're going to be in charge of carrying the class lunch boxes, like the crate of them someplace else. Or we're going to push the chairs from one side of the room to the other. So we're all going to sit together at circle. Like there's ways that you can naturally tie it in. The other piece that's sometimes included as part of a sensory diet is environmental modifications. So this could be things, oftentimes these are written in a 504 plan of being able to make accommodations of, preferential seating to kind of limit some of that visual stimulation that's going on around you, if that's something that can be very overly distracting. Being able to make sure you're not the one that's sitting next to the printer that's going to go off. If you have some sensory sensitivities auditorily, that could just set you off for the rest of the class because the printer just went off. So just being able to write in some of those environmental modifications can also be part of your sensory diet, sensory plan as well.
Yeah, that makes me think of the fire drills or any of the numerous drills that our children are having to do now that we necessarily didn't have to deal with when we were younger. But just whether it be the warning or the headphones or something, in 10 minutes, we're having a fire drill. You might want to put your headphones on, or, if you're not to that point of independence, having, the teacher or the one-to-one pop the headphones on and maybe take you out before everybody else.
Right. And even practicing that when that goes on, that you have the headphones, because, obviously we don't want it to ever happen. But if there ever was a situation where the fire drill goes off, that's still a strategy that could be used where then they can learn, well, then I just get my headphones and put them on, and then we still do the same routine. So those kinds of things to proactively build in are great.
Yeah. Yeah. Parents can really sort of collaborate with their team or even with other parents in the community and find creative ways to request these accommodations.
Absolutely. Yeah. And the school providers should be able to help you with it, to be able to come up with these plans.
So the next thing I wanted to talk about, if it's okay, I'd like to move into what you did on your thesis, actually, because both of my boys participated in those programs at different times. And I think they were extremely beneficial for both and still is for Colin. And it's not a mainstream therapy. So maybe you could provide some insight for people listening, and it could be another tool for parents.
Yeah. So the program that you're specifically referring to is therapeutic listening. And there's all kinds of listening programs, auditory based programs that are out there. You do need to be a trained provider in order to be able to do it. So it's not something that all occupational therapists do. Many of them are familiar with it, but it's something that if you're interested in, you should find out if this is something that they're specifically trained in and that they are comfortable doing. If not, oftentimes you can go onto the websites and you can type in where you are, and they'll let you know what providers are in your area for those kinds of things. But the idea behind the listening programs really has a lot to do with the vestibular system that we were talking about. So again, vestibular system is really the core of sensory processing. And what's really cool is that the target of it happens in your inner ear. So what they were finding is that by using some of these therapeutic listening and listening programs, you can actually stimulate the muscles and things within your inner ear and passively target your vestibular system. So this was a way that they were seeing whether or not you'd be able to make some changes happen, literally by listening to some sort of program, some sort of music. And there's controversy that's centered around this initially, because when it first kind of was rolling out, it was being done with this device called the electronic ear that was not FDA regulated. And therapists were actually losing their license for using it because it was something that was not regulated. Then they started coming out with these other programs where instead of it being like a medical device, they're using back in the day it was CDs, and now they're using these microchips and things. But the CDs actually were using modulated music that involved subtle changes in the sounds and the fluctuations in the tones of the music. And when those changes happened, that's what would activate things going on in your inner ear, and it can affect your vestibular system. And so ultimately, with the therapeutic listening program, they see that it's something that can help with sensory processing in a whole lot of different ways. So there's several different programs that are out now that do it. Therapeutic listening is the one that I was familiar with. The listening program was another one that was around at the time. I'm not quite as familiar with it, but the reason that I gravitated more towards the therapeutic listening one versus the listening program is because at the time, the listening program was a set progression of sounds and tones that you would go through, regardless of who the person was, is how I was understanding it. Whereas therapeutic listening, I really liked because you could individualize the program based on the needs of the person that you were working with. And so there was many different CDs and programs that you would use, and you would design it based on the tones and the fluctuations of that album to meet the needs of the child. So it was something that I was really interested in and wanted to see, how the effects of it would be on improving and increasing like the play skills of a child with autism. And so that's what I did with Aiden. And we did this therapeutic listening program for a period of weeks. We can't conclusively say, one way or the other, whether or not this does improve the play skills of kids with autism, because it was just single subject design, right? It was just, did it work specifically with Aiden? And for him, it did show that it had some positive effects, and it increased his engagement with what we were doing. And he tolerated it, really well with the headphones. But, for those interested in the program, just to kind of be upfront with it, it does require you to be able to tolerate wearing headphones. So for some children, that can be a challenge. With really, really, really young children, they actually do say that you can do it over speakers, and you have to position the speakers in a certain way to do it, but they say it's not quite as effective. It's not as powerful that way. But you do wear the headphones, and you do it twice a day, every day. It's intense. Like, you have to commit to doing the program, but I loved that it could just be a way to passively make a change. And you could do it when you were doing any other activity other than just looking at a screen. So not while you're looking at the computer, playing video games, watching TV. So we would incorporate it during therapy sessions, for part of it, where he would be, doing a motor activity, trying to hit targets with the beanbag while he's on a swing, while he's wearing the headphones. So in general, there's a lot going on to his sensory systems all at once while we're doing it. But he did really well with tolerating it. And I've done it with several other kids. I've actually done it with my own son twice.
Mm-hmm.
And he actually remembers doing it. And there have been times when he's felt very dysregulated, and he's like, I think we should do the music again and see if that helps. But he's done the program as well. And I have seen very positive effects with it. What the kids hear when they listen to it is, different songs, and they sound like all of a sudden the tones might change, like the volume might suddenly change, or you'll hear like a sound, which those subtle changes in the music are what is doing the stimulation and the activation of the vestibular system. I think it's a great tool to use. So if it's something that you're interested in learning more about, you can definitely, ask an OT and see if it's something that they're familiar with.
Also, I can put in the show notes if you have a website that maybe tells you a little bit more about it. I think there's like one in particular that you correctly.
Yeah, so therapeutic listening is the name of the program specifically that I was familiar with, and was certified in. So that's the one that I've given you the information of before we did the research study with it. But I can give you that information, sure, if people want to learn more about it.
Okay. If you would, the same with books, I would love to be able to recommend to our listeners maybe 2 or 3 reads that are parent friendly that might help them understand this a little bit better, because not every OT has this skill set. I mean, let's be honest. And, it will help them learn a little bit more and maybe use some strategies at home.
Yeah, my favorite one that's actually been around for a while and it can be found oftentimes in libraries is The Out of Sync Child. It's
Mhm.
by Carol Kranowitz, I believe. And what I like about it is it's very family friendly. It's a very easy read to better understand sensory processing and all the different sensory systems. But then she came out with one that was even better once you read that one called The Out of Sync Child Has Fun. And it's all these play based activities where once you see, this is the area that I want to be able to provide some additional support for my child, you can look at this other book under that specific area. And it's like a cheat sheet of activities that you could look up and be able to do. So it's very parent friendly.
Wonderful.
Those are great ones that I always point families in just to kind of get a general overview of it.
That's excellent. I have not read the second book, so I'm glad that we're talking about that. And just in your opinion, how do you see the accessibility to OTs right now, especially after COVID? Like, is it kind of like everything else in the field where sort of, at a deficit of providers? I mean, if somebody's listening to this pod and they're like, okay, we're missing this piece, and, say 25 people from our area in Baltimore want to access services, are they going to have a hard time? Are they going to have a ginormous waiting list?
I think that there's a variety of different ways that you can access services, right? It could
Mhm.
be through the schools, it can be privately. I know where I am right now in DC, everything is all in person. It's back to doing that within the schools. Um, but I think that what we've learned with COVID is that there are ways for people to be able to access remotely as well. So there's a lot of providers who, especially with the sensory processing piece, that can provide some parent education and things remotely. You can do a lot of that kind of evaluation remotely as well, just to kind of get a baseline and see where you are with things. And so there are definitely areas where the therapy services were not as prevalent, but now they're actually having more access because of the ability for the remote services to be provided.
Mhm.
So I think across the board, related service providers are always in demand, right? There's always a need for it. I think in terms of whether or not people are going to be able to access it, definitely has to do with the individual region and their staffing at the time. Um, but I think that the way that those services are being provided is being viewed kind of more broadly than it has been in the past.
Okay. Okay, good. I tell you, anytime I meet like a young person getting ready to graduate or just even starting high school, I'm always trying to nudge them, consider consider this as your path in college, because you will always have a job. The statistics continue to go up. They're not plateauing and they're certainly not going down. Our community needs more therapists, whether it be speech, OT, special ed providers, music therapists, whatever it might be. So please, please, please consider this as a career option because you will have job security. I really lay it on thick for these kids
For
because we
sure. For sure. But also like being able to access your resources too, for for some families, it can be very costly if you choose the private route, right? So a lot of providers don't necessarily accept insurance, or there's some cost upfront that you have to pay that then gets reimbursed partially by insurance. And so that can kind of be a limiting factor for some people, especially for the evaluations. But oftentimes, if that is a route that you decide to go, those providers will accept some of the testing that you can get done for free within the schools. So don't necessarily look at, those evaluations as being mutually exclusive information for the school, but you have access to that information that you can use in other ways as well.
okay. Yeah, that's very good advice. The one thing about living in the area that we live in Baltimore is there are so many resources. But having said that, having Kennedy Krieger in our backyard, having Mount Washington Children's Hospital, like all these amazing places, but they're again, their wait list are at least a year. When we were just starting, 16 years ago, um, it was about 6 months, and now it's definitely well over a year, if not more. It's just my greatest hope that, we just have more access to more therapists in the future. I almost sometimes wish like it was like in the good old days, like Little House on the Prairie, where the doctor comes to your house. And we do actually have a therapist that comes to our house and does a very specific type of therapy with Colin called Spell to Communicate. I think we briefly discussed about that. And it's wonderful. But boy, do I wish I had like an OT that could come here like 3 times a week and help with certain things. And we do private speech and we go to that person. But, again, it just goes to it. There's just not enough in the field. But I know
Yeah.
the people in the field have their hearts on their sleeves and will do anything and everything to help our community.
And there definitely are providers that do go to homes.
Mm-hmm.
So don't count that out as an option. It definitely takes some digging to find, but it's more like the private providers. If it's a school based provider, those services obviously have to happen within the school day at the school.
Mm-hmm.
But private providers oftentimes do go into the homes and do therapy there.
Yeah. Okay. I'll definitely keep digging. And, there's a lot of parents out there who are, very resourceful and always researching. And we share what our findings are. Is there anything else that you want to discuss or any like profound advice? This is a very scary, unknowing journey when you first get a diagnosis. And of course, what I would say is when we first got ours, we got it through neurology and then through Kennedy Krieger. We did 2 evaluations for both boys. To be honest, 15, 16 years ago, it was quite meek, the advice that they would send you off with, if not traumatizing. And I just want to say that it's not the end of the world. It's not the end of life. My oldest son, Aiden, is a perfect example of overcoming so much adversity. And Colin is too. He may have a different presentation and a different set of challenges, but he has overcome so much and continues to every single day. So I want parents to be empowered and just know that just there are so many tools and support. Don't give up. Don't give up. Don't jump in a black hole. We're all here to support you.
Absolutely. And I think the right therapist is going to be the one that helps you see that. The therapists really only work with your kids, an hour, 2 hours a week. You're the one that's really there the whole rest of the time. You're the one that knows your child the best. And so there's different strategies and things that, we can give you, but ultimately you're the one that is going to be able to use those strategies and provide additional insight to the therapists. That communication piece, I think, is key, with the therapist being able to talk with you, give you recommendations and ideas, try them out. If they're not working, make sure that you let them know and work together as a team, because that communication piece, I think, is going to make things go a lot further.
Yeah, and I think what has become commonplace in our homes, in our community, are trampolines, swings, crash pads. In some cases, replace people's living room furniture. But if not, there's again so many adaptive equipment that we can just integrate into our home to help our kids.
And it's becoming so much more commonplace. I remember 15, 16 years ago, fidgets, right, were something that were really only done with children who had special needs as like a tool. I had a little box of a variety of fidgets that I would use. Now you go to the dollar store and everybody has them, right? So
You're
what does
right.
that let us know? That these are needs that everybody has that are just heightened in other children. But really, this is something that, a lot of kids can benefit from. But I think some of the access to some of these tools and resources is becoming a little bit more available to the, in the community as well, which hopefully also brings the price of some of these things down too, because
That's
I know
right.
some of that equipment is way costly. So I'm glad to see that some of that stuff can be more easily accessed to.
Yes, and shout out to the stadiums and venues that are starting to accommodate our kids. Even airport with the sensory rooms. It's huge. We're really breaking through barriers, you know?
Yeah, I remember it used to, the movie theaters was something that, was a really big deal a few years ago. And now you're right, you're seeing it other places as well.
Yeah. Well, Shayna, I want to thank you so much for coming on and talking with me. And I think we definitely covered some really important territory and hopefully very, helpful, sort of maybe eye-opening information for some families. Just continue to empower our community.
Thank you. Thank you for having me. It was great talking with you.